Hello, I'm Dr. Payal Chitranshi, an ENT surgeon from Restore Hospitals on road number 1 at Kukatpalli. Today, I am discussing about cholesteatoma. Now, what is cholesteatoma? Well, cholesteatoma is an extra growth of skin or a skin cyst in the ear. It generally extends in the middle ear and it can spread further in the bone behind the ear, which is called the mastoid cavity. Well, this cholesteatoma is not a cancer, but it does have a spreading property, and slowly and gradually it involves more and more bone and can finally lead to complications. So, why is the cholesteatoma formed in the middle ear? Again, here it is due to the dysfunction of the eustachian tube. The eustachian tube is a tube connecting with the back portion of the nose or throat and the ear. So it helps in the ventilation of the middle ear cavity. If the eustachian tube is not functioning properly, there's a vacuum created in the middle ear which should actually be filled with air. There is a vacuum instead. So the skin of the ear canal and the eardrum is drawn inside, forming a retraction pocket. If this retraction pocket is left untreated or the eustachian tube function continues to be abnormal, then it gradually tends to grow. Dead skin and debris and waste material collects in the cavity and it involves the bone behind. The dead skin acts as an ideal environment for the growth of bacteria and fungus. So as the cholesteatoma grows, it leads to ear discharge, foul smell. It can lead to compression on the nerve, like the nerve supplying the muscles of the face. It can lead to giddiness. It can lead to pressure symptoms like headache. If left untreated, then it can spread further to involve the brain, leading to meningitis or even brain abscess. Hence, cholesteatoma should not be neglected. If there is a constant foul smelling discharge coming from the ear, or any of the symptoms of dizziness or blood stained discharge or weakness of the facial nerve, you need to immediately consult your doctor. But the good news is that cholesteatoma is treatable. When you come to the doctor, he will first inquire about the duration of the symptoms, whether it has been persistent throughout in spite of treating with medicines. Then he or she would do an otoscopic examination to check the condition of the ear, where it would be possible to see skin flakes in the ear canal and the bone behind the ear. Also, you might be recommended a CT scan. The CT scan will show the condition of the bone behind the ear and the tiny bones which help in hearing within the middle ear cavity. It will also help us to rule out any complications or any involvement of the brain due to the cholesteatoma. Further, a PTA or an audiometry would be done, which will show the status of the ear ossicles or the tiny bones in the ear. It will also show whether the hearing loss due to the cholesteatoma is treatable by surgery or it is a permanent hearing loss which can happen due to cholesteatoma. Cholesteatoma has to be treated surgically. Just medical management with antibiotics and ear drops will not be sufficient. However, if treated early, it can be completely removed and the ear can be made disease free. If left neglected, then it continues to grow, though slowly, to involve the surrounding structures. We at our center in Restore Hospitals are regularly treating patients with cholesteatoma. We have the required microscope and drill which is used to remove the bone. Thank you.
Done specifically for those patients who don't have much amount of mustache hairs or beard hairs, Or in those patients who have scarring alopecias, we have many burn patients whom we did transplants on those beard areas and we got excellent results for them. But what is the reason that you go for these mustache and beard transplants?